discussions. And you can also join on there live. Right now I'm streaming it simultaneously, so you can also join via the YouTube. Yes, so thank you so much. I'm starting the recording too now. Yes. All right, so we have, sorry, let me mute this. Okay, sorry about that. All right, so today we have two qualified and professional people who work in the area of breast care and breast cancer management to speak to us. And the first to go is Dr. Florence Dewey. I don't know whether it's Dede or Dede. Well, when she speaks, she'll tell us the right pronunciation, but I hear people say it differently. So she is a lecturer and general surgeon on the breast unit, Kolubu Teaching Hospital. And then we have Janet, again, I'm not sure if I'm pronouncing it well, Brakohiapa. Hopefully when she comes on, she also pronounces it the right way. Okay, so she, just a second, let me pull up her short bio. So Janet was born in Germany and raised in Ghana. She's a mother of two lovely boys and a lawyer who has been called to the bar both in Ghana, West Africa, and in Ontario, Canada. She's also the founder and director of Safe Haven Cancer Support Society in Ontario and Safe Haven Cancer Support Center in Ghana, which are registered non-profit organizations in their respective countries. So we'll have Dr. Dede speak first, and she will talk to us about her work and then also about breast care and then breast cancer management. Then we'll follow with lawyer Janet Brakohiapa. I'm very excited to have this conversation. I believe that at the end of the day, we'll receive all the information that we need because these are seasoned people in this area. All right, so Dr. David, can you hear me?
Yes, I can.
You can, okay. I hope everybody else can hear her. I can hear her. Hello?
Yes, we can hear her.
You can, all right. That's great. So yes, please tell us about your work and then also breast care and breast cancer management. You can show your face, please.
Well, it says you've disabled. It says you've disabled that.
Oh, really?
Yeah. So I'm not allowed to do that.
Okay. I've activated it now. Please go ahead.
Yeah.
All right.
All right.
The floor is yours.
Thank you. So thank you very much for the invitation to be on the program today. I'm Florence. The surname is Dede.
Dede. Oh, wow. We've all been pronouncing it wrongly.
Well, I keep saying I don't really mind. Once I know you're calling me, I can't really be bothered how you pronounce it. So no problem about that.
Okay.
I'm a lecturer with the University of Ghana Medical School in the Department of Surgery. And I'm also a general surgeon. As a general surgeon, there's quite a bit that we do, but currently my line of work is mainly with breast diseases because I work on the breast unit. So the majority of the work I do in general surgery falls under breast. And that can be not only breast cancer, but also breast diseases that are not breast cancer, although I think a lot of what we see is cancer. All right. So in terms of my work, well, like a doctor in any hospital, we have outpatient clinics. So we see people who come in and go We have emergencies. We see those who come in a bit more ill, usually needing an admission. We take care of patients on the ward. We operate. I think basically that covers what we do. Like I said, we see both cancers and diseases that are not cancers. Anything else you want to know about my work?
I think that's about it.
All right.
Yeah.
So then
yeah,
go ahead.
Yes, so you can go on and tell us about breast care and breast cancer management.
All right. So I'm not sure there's specifically a lot we need to do in terms of breast care. It's I think just as the breasts are part of the body, just as we take care of our bodies. So in terms of making sure we are eating well, because whatever we eat affects every part of our body. So healthy diets, a lot of fruits and vegetables, avoiding the unhealthy things, exercising, that's also good. All these things kind of affect every part of the body. So for breast diseases as well, especially breast cancer, it's known that women who exercise more tend to have less of that. And then also maintaining a healthy weight, avoiding alcohol, avoiding smoking. So these are really very general things that affect our health, but it's also been found that it also helps to reduce breast diseases, specifically breast cancer. Apart from that, in terms of the social habits and taking good care of ourselves, I wouldn't say there's really much we would do or anything extra that we do to take care of our breast. But maybe what I'll chip in here is looking out for diseases in the breast, because we know that breast cancer, unfortunately, is quite common. It's the commonest female cancer in Ghana now. It forms about a third of all female cancers. And as much as it tends to be a disease of older women, or more common among older women in other parts of the world, unfortunately, in our part of the world, or in Ghana, as in other sub-Saharan countries, it's sub-Saharan African countries, it tends to be to occur a little earlier. So we tend to see quite significant numbers in their 30s, 40s, 50s, which is not so common out there. So we say that the common age group for developing breast cancer here is in the 40s and then in the 50s. It doesn't mean we can't have somebody in the 20s get breast cancer or in the 80s get breast cancer. It's affected, cuts across, but more common 40s and 50s. The thing with breast cancer is that the things I mentioned in terms of healthy lifestyle and all that can help to prevent breast cancer. But by and large, it's prevention. It wouldn't prevent all breast cancers. So you can do all that and still could be at risk of breast cancer. So when it comes to breast cancer, we tend to emphasize quite a bit on early detection, trying to pick it up early. Because like I said, you may try and do the right things, but still end up getting breast cancer. So maybe that would bring me to the risk factors. Risk factors would be, one, the fact that you are a woman. So I've already mentioned women along the way. It happens in men as well, but it is not so common. So if you take every 100 breast cancers, 98, 99 will be in women. So overwhelmingly, it's a disease of women. So typically, we just tend to talk about women, but it can occur in men. So being a woman, first of all, increases your risk. Advancing age, like I've mentioned, for us, commonly 40s, 50s, but the older you get, the more likely you are, or the more chances you have of getting a breast cancer. So let me explain a little. If you get an 80-year-old coming to your clinic with a breast lump, the chance that that lump is a cancer is so much higher than if you have a 30-year-old walk into your clinic with a lump. That could be many more things rather than a cancer. So the older we get, if we develop problems with the breast, the more likely it is to be a cancer. So advancing age increases our risk. And then family history is an important one. So for someone whose mother, especially mother, sister, or daughter, those are what we call the first degree relatives. If anybody like that in your family has had breast cancer, then the chance that you could have it is high. And that's simply because you share the same genes with these people. So, of course, you also share genes with your aunties, with your grandma, with your cousins. So family history is not limited to mother, sister, daughter, but those tend to have a higher risk. But generally, if there's breast cancer in the family, the risk that you would also get it or could get it is high because of the fact that we share the same genes, and the problem may be because we are carrying, let me say, faulty genes, for use of a term that we can understand. All right, so family history is important. For people who've had breast cancer before, there's a risk that they could have it again. So in the same breast, if that breast was left behind during the treatment, or in the other breast, if the other one was taken away completely. So having had breast cancer in the past can give you that. So these are risk factors we say are not modifiable. I mean, we come into the world as female. These days, there are all sorts of funny things going on. As by and large, you are born as a woman or you are born as a man, and you can't, to a large extent, change that. With time, we all grow old. We can't change that. You can't, even if you decide you've taken yourself out of your family, you can't change your genes. You have it. So even if you disown the family, it's still the same genes. If you've had breast cancer before, you can't change that history. So these are things we say are not modifiable. We really can't do anything about it. But then there are the modifiable risk factors. So all the lifestyle and lifestyle changes or lifestyle stuff I talked about, healthy eating, keeping a good weight, no alcohol, no drinking, those are things we can modify. And then this one could or could not be modifiable, that is having children. Some people choose not to have children. So maybe for them, it's modifiable because if they had wanted to, they could. Others are not able to have children, so it will not be a modifiable risk factor. But we know that generally for people who have not had children, their risk of having breast cancer is higher. For people who have their first child at an older age, again, the risk is higher. So your firstborn after 35, the risk is higher as against someone who has their first child, let's say less than 25. And then whether you breastfeed your children or not. So again, that works along the path of our hormones. So it's good to breastfeed our children because when we do, it helps to protect us against breast cancer. So these are all hormonal risk factors, which, like I've said, can be modifiable or not depending on the situation in which you are. So having talked a bit about the risk factors, the important thing is that we need to look out for the breast cancer. So going back to the breast care, it's important we talk about or we emphasize, especially in our part of the world, that we should examine our breasts monthly. So when you go to the more developed world, they have well-established screening using mammograms. And these are done regularly. A mammogram definitely, by far is able to pick up any abnormality in the breast even before your fingers can do that. So when you're having regular mammograms done, then the use or the usefulness of the self-examination is limited. But in our part of the world where we have people still showing up on the first visit to the hospital with a lump that is 10 centimeters, with a lump that fills the whole breast, with cancer that has already spread to other parts of the body. Because we have so much of that, we find that it is indeed still useful for us to talk about doing breast examination. And even in the places where they say it's not so useful, they still talk about it being useful in terms of being aware of what your normal breasts are. Because if you are not aware of what your normal breasts are, when there's a change, you wouldn't even know. So by and large, examining the breast, I think is a good practice. It's a good habit that we should all adopt. And we encourage that right from the age of about 20 years, because it's very rare that you get a lady with breast cancer below the age of 20. We've seen a few teenagers with it, but it's very rare. So usually we say from the age of 20, once every month, about a week after your menses has ended, examine your breast. And it's basically just using the flat part of your fingers and pressing between your finger, pressing the breast. So pressing the breast between your finger and the chest. So when you do that, if there's any lump in there, you're able to feel it. and you want to examine the whole thing. So you can decide to go from top to bottom, all the way from the lateral or the outer edge to the inner edge. You can decide to do, so come this way. You can decide to do it like that all the way. You can decide to start at the middle and then go around in circles. But the important thing is examine the entire breast.
Yeah.
One common, what's the word to use? Okay, let me change the sentence. So people often would, sorry, I'm covering the, okay. Yeah. People often would hold the breast like that instead of examine it that way. So when you hold it that way, it feels like there's a lump. Almost everybody, if you hold your breast this way, so you hear people talk about the common or the normal breast lump. There's no normal breast lump. If you examine it in the right way, you will not find a lump. So if you do that and you feel a lump, more often than not, when you examine it in the right way, you realize there's actually no lump. So the important thing is to examine it in the right way. And if you feel a lump or you feel any like hard area, anything that feels like a pebble, like a swelling, anything like that, then you need to report to a hospital. So the commonest symptom of breast diseases, or one of the commonest, would be a lump. And it's the commonest symptom of a cancer as well. So if you find that there's a lump there, which is usually painless, again, that's something that causes a bit of trouble, because most people know that cancer is painful. So they find a lump is painless, and because it's painless, they think, I don't need to go to the hospital, but this is not cancer. But cancer usually starts as a painless lump. So once you find there's a lump, don't sit at home and decide that this is something I need to bother about, or I don't need to. Go to hospital, have it looked at, have it checked out, the necessary investigations done. Conclusions can be drawn, and then if it's said that it's nothing, then you can relax.
Sorry, before you go on. Yes. So we are talking about breast cancer, but when you mentioned other breast diseases, it got me curious. What are some examples?
Some of the others. All right. So in young people, a common one is something we call a fibroadenoma. So it's a very well defined, like a little smooth pebble that is in the breast. Well, there are different sizes of it, so it can be very small, it can be big. When you touch it, it tends to slip away from your finger. It happens teenagers, 20s. It can happen in a bit older women, but it is not cancerous. So quite a number of women, especially young women, can have that.
What usually causes that? Is it known?
It's unfortunately we don't know the exact causes or the exact reason. So that's why even when I talked about what predisposes us, I mentioned risk factors. I didn't mention causes, because we don't know the exact reason why somebody gets it, somebody doesn't. You may have all the risk factors, you wouldn't get it. You may have none of the risk factors, you could get it. So it's a little dicey. The science hasn't been able to explain everything yet. The same with the benign ones. We are not too sure why somebody will get it. Somebody gets it once, you take it out, and never comes back. Somebody comes the first time, they have 3 or 4 or 5 in their breast. It may continue to grow, they may get other ones. So it's a little difficult to tell. But that is something that is quite common. Another common one is infections. So especially for women who are breastfeeding, they can get like a boil or an abscess in the breast. So that is also something that is quite common in women who are breastfeeding, or women who have some depressed immunity for some reason. Let's say those who are diabetics, who are not well controlled, or have some other illnesses that may depress their immunity.
Is it the same as a cyst?
So a cyst, no. So an abscess is an infection. So an abscess is a collection of pus. So that is an infection. So usually it will be painful. It may give you a fever when you touch it. It may feel warm. It's very painful to touch. So that's an abscess. A cyst is just a collection of fluid. So that's also very common, actually, a collection of fluid. So a cyst is just a simple, there are different types of cysts. The commonest one are the simple cysts. Usually we don't even bother to do anything about that, because it's nothing to worry about. So you have simple cysts, but you have other types of cysts. So some cancers can show up as cysts. So we have what we call complex cysts. So when a scan tells us that a cyst is complex, then we go further. We don't just leave it alone. If it's simple, we are not worried about it. We leave it. If it's bothering the person, it's very big, it's painful, we can put in a needle and draw out the fluid. That's how we treat a simple cyst.
And the scan is the same as the mammogram?
When we say scan, usually we're talking about an ultrasound scan.
Okay.
So the mammograms are X-rays.
Okay.
And the scan, so to be more specific, ultrasound scan. But usually we just shorten it and say a scan.
Okay. So if you detect a growth or a lump, which one would you advise that the person does first, the scan or the mammogram?
Okay, so it partly depends on the age of the individual.
Okay.
Definitely for someone who is 40 and above, some people will use 35 as the cutoff. We advise that you do a mammogram together with an ultrasound because they complement each other. So when it comes to just screening, so you haven't found anything, you just want to go every year, every 2 years, go and check that your breasts are okay. Usually we'll just, more than 40, we'll just do a mammogram. But when you found there's an abnormality, some reason has brought you to hospital, then we would ask for both a mammogram and an ultrasound if you are more than 40. If you are less, then we would ask for an ultrasound scan. Because in the younger women, we know that the mammograms are not too sensitive. They are not able to pick up the changes that may have occurred there. There are a few other imaging modalities we can use, like MRI and a few other things, but those are not routine. Those are not commonly used everyday things. So generally, it's more of the mammogram and or the ultrasound that would be used. Okay. So I mentioned lumps, but there are other symptoms that can also be picked up. So for some people, they may notice one breast has become bigger than the other, and they don't feel a lump, but one is bigger or one is smaller. So it can actually be either of them that is the problem, either the one that is smaller or the one that is bigger. Obviously, you know where the change has been. So if the change is that it's become smaller, then where the change has occurred, that is where the problem is. If the change is that it's become bigger, that's where the problem could be. At times, you may notice some skin changes. So there's a typical one we call the orange peel appearance. So we know we all seen an orange before. We see the way the skin looks like with some like dots or dimples. The breast skin can begin to look that way, and it usually indicates that there's something happening. Not always cancer, but it could be cancer. At times you may notice that, yes.
Is this on the nipple or on the breast itself?
The rest of the breast. Rest of the breast. The nipple itself, the changes are that it could be drawn in. It could change direction. You could have a rash. You could have a sore. You could have a rash or a sore on the rest of the skin as well. And then these changes I talked about. You can have a discharge. So a lot of women actually have a discharge from the breast. And often it's nothing to worry about. But we tend to worry if it comes spontaneously. So if you only see it when you squeeze on it, when you squeeze it, then it may not be so worrying. But even that, if you do it and it's bloody, we tend to be a bit concerned. If you sleep and get up and there's a discharge, there's a stain in either your bra or your nightie or your bedding. So that means it came spontaneously. That tends to be a little more worrying for us. So we would want to investigate it a bit further. The thing with breast diseases is there's almost no symptom that you can see alone and say this one is definitely breast cancer. There are other, or it's only breast cancer that can cause that. There are other diseases that can cause the same symptoms. So it's always to have it examined. Well, go to a hospital, give your history, be examined, and then do the necessary investigations. At times you see something, you think, oh, this looks like a cancer. By the time you are done with the investigations, you realize it is not. Or you see something, you think this is not a cancer. By the time you've gone through, you realize it is. So we can't just sit at home and decide that it is or it's not. It's important to seek professional help. Go to a hospital. Usually the procedure is that you talk to the healthcare professional, normally a doctor. They would examine you, and then they will ask for some investigations. We've already mentioned the mammogram. We've mentioned the ultrasound. And then if we are at all concerned, we will ask for a biopsy. So a biopsy basically means putting a needle into the area that is abnormal, taking a bit of the tissue from there and sending it to the pathologist. So we say that the pathologists are the temple of truth. They would tell us whether it is a cancer or not. I may look at it and say, oh, 99% it is. They may prove that it is not. Or I'll say it is not. They will prove that it is. So we need that input from pathology to be able to make a definite or a sure diagnosis. So a biopsy is usually very important, especially in the setting of a suspicion of cancer. So once a cancer is diagnosed, then the next thing obviously is to treat. There are different modalities of treatment, and an individual may require either all of them or a combination of some of the treatments. And the sequence in which we give the treatment is also different for different people. Okay. So the modalities would include surgery, would include chemotherapy, which are drugs that are given specifically to treat cancers, radiotherapy, which basically means applying some radiation to the area that you want to treat. Immunotherapy, there are some medications that are specifically targeted to the very specific types of cancers that we have. So as much as we are talking breast cancer very broadly, when you take, let's say, 10 different people, they may have different types of breast cancer. So we say some are hormone positive, some are hormone negative, some are HER2 positive. There are different grades, there are different histological types. So there are a lot of characteristics that we look at that make difference, and breast cancer is different for different people. And all those characteristics feed into how we treat the patient. So if there are certain specific markers, then we'll target those ones with immunotherapy, for instance. And then there's also hormonal therapy. I mentioned hormone positive. So those who are hormone positive benefit from hormonal therapy. So those are the treatment modalities.
So with those people, they don't need chemotherapy.
So usually, like I said, you may need so somebody can actually need all five. So somebody may start with surgery, go on to have chemo and immunotherapy, have radiotherapy, and end up with hormonal therapy. They can do all five. Others may just need 2. Surgery, radiotherapy, they are done. Some may need 3, chemo, surgery, radiation. So it's, like I said, we look at various things, and then we plan the treatment based on what we see. Okay.
And with the surgery, is it the complete removal? Or...
All right. So there are mainly 2 options. One is the complete removal, which we call the mastectomy. And then the second one is taking a part of it out. So some will call it lumpectomy, some will call it a partial mastectomy, some will call it a wide excision, breast conserving surgery, all sorts of names. But basically, you are taking the cancerous part out and leaving the rest of the breast. So unfortunately, most people know about the mastectomy or the complete removal. And because some people are not comfortable with that option, once they find something suspicious, at times they won't even wait for the diagnosis to be made. Once there's something suspicious, they won't even come to hospital to be told that it's a cancer and I have to have my breast cut off. But for all you know, it's not even cancer. Or even if it is, there's that option of actually taking the cancerous part and leaving the rest of the breast. And generally, the earlier you pick it up, the more likely you are to be able to keep the breast. So if we delay and we don't come to hospital early, by the time we come, it's advanced, and then the only option may be having to take the whole breast off. So the 2 options are there, and there are things that will qualify you for one option or the other. But generally speaking, when it is found early, you can have the breast left for you. So and then with surgery, sorry,
please finish.
I was just going to add that with surgery as well, there's also reconstruction. So especially where the whole breast is taken off, we work with the plastic surgeons, and they can create or formulate a new breast for you. They have different ways of doing that. They can put in an artificial material, usually made from silicone, so they can put it under the skin. They can use your own body tissue. So they can either use some muscle and tissues from your back or from your tummy and just swing it towards the breast area and form a new breast. So that is also possible to do.
Okay, that's interesting. Okay, so in your practice so far, usually those who eventually develop breast cancer, how long after discovering a lump does it present as cancer, if it's cancerous?
I'm not sure I'm getting your question. As in, how long does a patient take to come to hospital?
No, like when they come and they give you their history and they tell you at such and such a time, I discovered that I had a lump, and then they've come to the hospital and it's cancerous. Have you noticed a particular time frame between when they said they discovered the lump and then when it became cancerous?
All right. So a cancer will usually start as a cancer.
Okay.
So it's not like you have a lump and then you've had it for 2 years and then it becomes a cancer.
Okay.
That is quite rare. There are certain conditions that can predispose you to getting a cancer. So there are certain changes that we may see and may make us want to keep an eye on you. But I mean, usually it's not like you even feel a lump or anything like that. So usually it starts straight away as a cancer. So once you feel the lump, it's been there for a while because it starts as just cells, abnormal cells. And then it multiplies and multiplies, becomes big. So finally you can feel it. That's why doing the screening mammogram is important. Because even before you can begin to feel, the screening mammogram at a much smaller size would be able to pick up the abnormality. So it can be as small as 1 millimeter and have been there for just 1 month and be a cancer. Because it starts off as a cancer.
Okay, thank you. So about the screening, apart from the hospitals, are there other places where we can go to have our breasts checked?
Okay, so like I mentioned, it's important we all do our own examinations at home. And then we recommend that at least every year, for those who are more than 40 and between 20 to 39, every 3 years, that's if you don't have any strong family history or any strong risk factors, at least every 3 years for that age group. But from 40 every year, go to a hospital or go to a qualified health person and have your breast examined. That's just clinically an examination. When it comes to the mammograms, which is actually what is the best way of determining or picking up cancer early, that's one, like I said, they are x-rays. So in some hospitals, you have those machines available. The other place you get them is the diagnostic centers. So you realize that there are certain places where they are, it's not a hospital, but we call them diagnostic centers. So they do x-rays, they do CT scans, they do ultrasounds, they may do lab tests and stuff like that. So those are basically the two main areas where you can have these tests done.
Okay. Thank you so much. You said so much. I've learned so much already. We'll go on to Janet, but before then, is there anything else you want to add on before we have?
For now, no. Let's Janet talk. If you leave me, I'll talk for the next 3 hours.
All right.
Yes, let Janet talk, and then if there are questions, we can answer.
We'll answer them. All right. Janet, can you hear us?
Yeah, I can hear you. Yes, can you hear me?
Yes, I can hear you.
Okay. Can you see me?
Yes, I can see you.
Okay.
Thank you. Sorry, you can see yourself.
I see.
Yeah. So thank you so much for coming. Yeah. So please tell us your story and then about the safe haven centers in both Ghana and Canada. So the floor is yours.
So thank you so much for having me on your show. It's an honor. And so, yeah, as my bio said, I'm a young lady, very young.
We can see that.
Yes. I live in Canada, and I've had, a few run-ins with cancer, not just myself, but also my late husband.
Oh, okay.
He got diagnosed with cancer at stage 4.
Oh,
and unfortunately, he didn't make it because the symptoms were there. We didn't know that these were signs showing us that he was sick, right? So by the time we found out, it was too late. 3 years after he died, I got diagnosed. Thank you. Am I frozen?
It went off slightly, but you're fine now.
Okay. So 3 years after he died, I was diagnosed with breast cancer. And the way it happened, so after he was diagnosed, I became very aware of the fact that it's important to know what is happening in my at all times. You know, I have to be very aware of how my body is behaving. If I feel something is off, I need to have it checked out. So it wasn't that I became a hypochondriac. It was just that I became more aware of things going on in my body. Something was off. I didn't just ignore it, right? I would investigate to find out if it was something that I should be concerned about or not, right? Which is very important. I mean, Dr. Dede talked about, prognosis and the importance of detecting some of these cancers and, like serious illnesses early, right? Because the earlier you detect things, the better your chances at living, of having a prolonged life, right? So with me, and it also talked about, doing self-breast examination, which is also something which is extremely important, because that's how I found the lump in my breast, right? And a lot of people that I've talked to, say the same thing. They just self-examining, and if they find a lump, they have it checked out, and sometimes nothing, sometimes it's something that is serious and has to be treated. So number one, you have to be very proactive in your in your healthcare, in just knowing, being very aware of what is going on with you. A year before I got diagnosed, I had symptoms, right? I had my hair was falling out. I would sometimes faint. My weight was going up and down. There was a lot of things happening, and I had it all checked out by my doctor, and they said everything was fine. Everything came back negative for anything serious, right? But somehow there was just something in me, some intuition that feel that there was something off, right? Although I'd been told, everything was okay. So that's another thing. You have to trust your intuition. If you're told that everything is okay, keep pushing, keep seeking for answers. So I found the answer when I found the breast lump. Okay. So immediately Dr. Dede talked about, different types of screening that you do. I did a
Okay.
The mammogram came back negative for cancer. They said they couldn't even see the lump, which I could feel it, but they said they couldn't see it. So I was happy for about a second, but then I still felt uneasy. So I asked for a second opinion. So that's another thing. If you are uneasy or if you feel something is off and you're being told you're okay, seek a second opinion. So I got myself referred to a breast surgeon who was very well known in the area where I lived and where I worked. And he examined me, and based on his physical examination, he was so sure that there was nothing wrong.
Okay.
He used percentages. He said he was 99% sure. And if you live in this part of the world, you know that people will not give you percentages because they're afraid of the risk of getting sued.
But, yeah.
Not say that, but he was so sure. He said he was 99% sure or 90-something% sure that I didn't have cancer. But, and I believe, because I pray a lot, I believe prayer is what saved me. He, in spite of the fact that he was so sure that there was, it wasn't serious, he did a biopsy. So then about a week or so later, I get a call, frantic, I should come into the hospital. And so I was told that, yes, I did have cancer. It was invasive and it was progressing very rapidly. It was aggressive, right? So if I had not trusted my intuition, if I had not sought a second opinion, I died. So be proactive about your healthcare, right? Don't ignore things going on in your body. It doesn't mean that you're a hypochondriac. You just have to be aware. And if you're uneasy, have it checked out. And if it gets checked out and they tell you there's nothing wrong, seek a second opinion if you're not at peace with yourself, because you have to have some peace, right? Know that, okay, you know, you're safe. And I didn't have that. And I'm glad I didn't have that peace. And because I didn't have that peace, I pushed, and eventually I was diagnosed.
So
I was
at the time you did the biopsy, were you still having those symptoms?
Yeah, you know, I was still unwell, but the tests that I did, you know, whatever tests they were doing, the blood tests and all that, somehow it didn't show. Because maybe because they were not suspecting cancer, maybe they were not doing the test that would like show that, you know, off. So, well, fast forward, I did treatment, everything that Dr. Dede talked about, I had everything. So I had a full mastectomy of my right breast. And then I had chemotherapy. Then I had a treatment because I was positive for some of the hormone receptors. So I had treatment for 18 months. I had that as well. I had radiation. So I had everything. And, you know, within that year, I think the next year, they found a second lump in my left breast.
Wow.
So we did a program for that, and you know, they did a set of biopsy. It's like they use ultrasound to do the biopsy. So they found that was benign. It wasn't anything serious, right? So I had that as well. So had my treatment, and I was referred to a support group in my area, right? At the hospital, I was referred to a support group. So what the support group does is, you know, bring people who have had breast cancer, who are going newly diagnosed people. And also sometimes you have professionals in there, nurses and doctors, and they all come together periodically to support each other, to talk about questions that you can ask your doctor, you know, it's like support, ongoing support, right? And I realized that I was the only Black person in that group. So I was wondering, why the only Black person who has cancer in the whole of the area where I live, you know? And it was very helpful because it gave me an idea, right? It just gave me an idea about how important it is, not just to be treated, but what happens afterwards. For instance, there was a lady there in the support group who had surgery before, and she had to have a follow-up surgery, but she didn't want to do it because she said she had no one to look after her cat. She was a white woman. And I found that very disturbing, you know, that someone would rather die than have surgery because she had no one to look after her cat. And I thought, I had so many people helping me. I thought, oh, I wish I could give her some of my people. But it made me realize the importance of having a support group, because while she was there, people told her where she can get, you know, support for her cat and all that. So in the end, that saved her life. So then now I come into my community, like I'm saying, there are a lot of Ghanaians here in Canada, and I hadn't really met anyone who had breast cancer. And when you talked about it, people will look at you funny, you know, it was like some sort of mystery surrounding it and all that. So I said, no, this can't be right. And just backtrack a little bit. So the support group that I went to, you know, they talked a lot about things which were not culturally relevant to me as a Black woman. So I went looking for something that looked like me. And right, there was nothing. though after a while, I had people got to know because I would talk about it. I was very open about it. So people started referring people to me to talk to me about cancer, the symptoms, and just my experiences. And I found that it really helped those people that I was talking to. So after a while, I was really doing it a lot, that someone suggested I start, Safe Haven, what we have as now, where Black women predominantly, I don't turn anyone away, but predominantly is Black women who've experienced cancer, survivors, those who are newly diagnosed, just coming together to support each other, because it is very important. People refuse to get treatment because of the mystery and the stigma and just the very limited resources that we have, to treat breast cancer. So I think people die prematurely, right? A few years ago, I was on a radio show and someone, told a story of how people were being branded as witches if they had breast. So it's things like that. So people do not seek help when they should. So the mortality rates are very, very high. So what we seek to do at Safe Haven is to demystify the whole thing, give people the resources that they need after they've done the treatments, and that the ongoing piece is very important, because
sorry, before you go on, don't you think fear is also a part of it? So what I've heard is, particularly with the chemotherapy, I've actually seen someone go through it and they'll tell you sometimes they feel like they are dying or there's so much discomfort. Yeah, so I'm thinking that could be also one of the reasons why some people shy away from seeking help and treatment.
Definitely. Fear is a very, very, again, it's fear of the unknown. There's a mystery. So that's why people who've actually gone through it have to talk about it. And talk about it. And we know it can be painful, but there's also ways to manage the pain. There's ways to just manage the whole process. But if you don't talk to someone, they're not going to be able to tell you. And our doctors, God bless them, but if they have not gone through, if they have not experienced cancer, they will not be able to accurately tell you what it feels like. So, we share with people our experiences so that it takes away the fear. I tell people, there's pain, but, take your medication before you go for treatment. Or, we talk to each other and we share experiences on how to manage the pain. It's not only that. I mean, we're very superstitious as a people, right? Very superstitious. Some people would rather go to church or, and I'm a Christian, I believe faith can heal, but I also believe that God heals in many different ways. And he has given us doctors, he's given doctors wisdom and the intelligence and the skill to treat us. So we cannot just pick parts of, how we think God can heal and leave the others. Because it's not everybody who can be healed miraculously. For those who are not meant to be healed miraculously, there has to be something in place. That's why we have science. And science and faith go together. You can't take one and leave the other, as far as I know. Right? You have to have faith in the doctors to be able to do their work properly so that you are healed. So science and faith go together. So it's very important. So we have the superstition, then we have lack of resources, right? People have their treatment and then sometimes they're not able to afford treatment, follow-up treatments, or, treatments that save their life. But, so again, when you have like a place like Safe Haven, even if you don't have the resources, we can point you in some direction to find ways to manage it. Or, although that is not what we do, it's not our mandate to fund treatment. There have been many times where we've raised money for people to have treatment, but it is not in our mandate, right?
Mm.
Something that we are resourced to do, and we cannot sustain it. But, we have many times, helped people or pointed them in the right direction, or reached out to friends who can donate money. And so those things should not be a barrier for people seeking treatment. You don't seek treatment because you think you can't afford it. Just go. Go to the hospital. Go to wherever you need to go, and let whoever is there figure it out. How to get you the help that you need. Yeah.
So if one is joining the support group or Safe Haven, what should they expect? You talked about your mandate. Can you list the things that you do by way of support?
Yeah. So we do peer support. So we have programs where, we just congregate at the center or on Zoom, and we have programs, we have educational programs, we have recreational programs, just to get the women together, to get them out of their head and out of, all the thing that's connected to the disease, just to give them a break, right? And we do cancer awareness and education. We do a lot of that with Dr. Dede. And also my brother, who is one of the directors, he's a radiologist. So he talks to us a lot about the importance of early detection, treatment, and, diagnosis of the disease. He talks a lot about different methods of screening, which is all very important. And then we provide emotional and spiritual support. If people want to pray, we let them pray. And we have Muslims amongst us. We have Christians. We don't take anybody away. So long as you're not coming to do any dark stuff, because we're there to help, right? And we just talk about how to manage your life after you've been diagnosed and you've received treatment. We have in Ghana and in Canada as well, we have support group meetings every other week on Zoom, right? So we have it on Zoom, we meet, we talk, we pick a subject and we talk, or sometimes we just talk. Sometimes we have experts coming to talk to us, about different aspects of the disease. And the center is open from Monday to Friday, I think it's from 10 to 3. So people can just walk in and, just go and sit down, have a chat with our nurse. We have a nurse who is on site. So it's 3 times a week, not Monday to Friday. It's 3 times a week. I think it's Mondays, Wednesdays, and Fridays. So you can just go in, get some resources. We have resources there on cancer, different types of cancer. You can go talk to her. We also have, for breast cancer patients, we have mastectomy bras. When you have surgery, there's a special bra and an insert that you need to make you look. We also know that when you look good, it makes you feel better, right?
Yeah.
So we provide those for free for people who've had surgery. We don't always have the prosthesis, but we always have bras. So people can just walk in and come and pick up a bra. What else do we do?
And this is for free?
Yes. Yeah, free. Yeah. And here in Canada, we have in-person meetings once a month. And so all over the world, like we have people calling from UK, US, Canada especially, and Ghana especially. So we do the Zoom meetings is like for everyone everywhere. Yeah. So yes. So we go on. Go ahead.
So when one joins, they can come as long as they are able to, or there's a particular time frame within which they can seek the support?
No, I mean, as long as you've been diagnosed or you're a survivor, and you want to, have some sort of, do I call it fellowship? with others, because people don't understand us, right? And people are, I wouldn't say afraid of us, but people don't want to associate with you because I don't know if they think it's catching or people must have done.
airborne.
Yeah, so the thing is, we formed a community of women who can rely on each, who can, socialize with each other without feeling the pressure of society's perceptions of who a breast cancer patient or survivor is, right? So that's very important because it also helps in the recovery process, right? We've had people come and then they got married. We attended their weddings, and people who thought they would never maybe experience love again because they lost a, but they got married, and we're just there to form a community of people to support each other and to just push each other on in life. Because speaking for myself, I think I became a much better person after I went through all this. I became more aware of life and the importance of living it to the full, the importance of, cherishing moments with loved ones. Life is short, I just became more aware of life and the fact that I can't waste time. So I think it made me a better person.
Yeah. So do you have support for family members of people who have had breast cancer or recovering, like those who come to the center? For example, you talked about marriage, and not even just family members, maybe friends. Is there some kind of program for them to also be able to help the one who is going through the experience?
So we don't have specific programs for them, but what we do, services are for not just breast cancer patients, but their families as well. But when we have the program, sometimes we have families come. We don't say because you're not a breast cancer patient or a survivor, you're not welcome. So they come as well. I've had conversations with families of cancer patients because they need to understand, and they be reassured. So we do. I have a couple of people who are not cancer patients at all. Is their families. Even the person who has cancer is not part of the group. It's them, right? Because they need that support, and they need to know how I feel so that they can sort of manage the person who's going through the challenge, right? So we do provide those services for families and people who support cancer patients and survivors.
Great, that's good to know. Okay, I think at this point I'll open the floor for questions. There are already a few in the chat, so we'll start from there. And then anyone else who wants to ask, you can either raise your hand or just unmute yourself and go ahead and ask. So Eunice says that, thanks for the informative and candid presentation. Be proactive about your health. God bless you. And then she asks, please, as a breastfeeding mom, would it be advisable to do the breast self-examination? Would it be accurate, or should baby be weaned first? Thank you.
I think Dr. Dede would be best.
Yes, I'm here.
Okay.
Yeah, so we know usually we breastfeed for quite a while, so wouldn't say over that entire period, it could be 1 year, it could even be 2 years we are breastfeeding, we shouldn't examine the breast. So what I would advise is do that examination after you have breastfed. So after you've emptied the breast and it doesn't feel so heavy, because when the breast is full of the milk, then it will not be that accurate. But once the baby has sucked on the breast and it's feeling quite empty, then I think that is a good time to do the breast examination. So you may, in those situations, you may not be able to examine both breasts at the same time. If the baby doesn't feed from both sides at the same time, then you may have to do one and at a later time do the other when the baby has fed from that side.
Okay, thank you very much. Eunice, I hope the question has been answered. Okay, so yes, it's Q&A time. If you have any questions, please unmute yourself, or contributions. If there's anything you'd like to share with us, please go ahead. Okay, well, okay. Edmond, I suppose that's your brother, you said, or your husband?
No, my brother.
Your brother, okay. All right, please go ahead, Edmond. Hello?
Thank you so much for your program.
You're welcome.
And I just want to always use the opportunity to tell people that, like Florence said, the fight against breast cancer start with the early detection, because now the teaching is that if you catch the disease early, when it's less than 5 centimeters, early disease is stage 1 and 2, which is like less than 5 cm. Then your chances of getting a cure and surviving at least 5 years is like 100% in the developed countries like the US, and about 91, 92% in the West African countries like Ghana, which is pretty good compared to what used to pertain years back. So the thing is to grab the cancer very early. Now, I want to say that with ultrasound, we can see lumps as small as 3 millimeters, 5 millimeters, just like mammogram can pick it up. So with ultrasound, and we've done a study, myself and Florence are writing something, we can pick up these little lesions, which puts it at stage 1, not stage 2. So for me, as a doctor, my aim is to catch stage 1 lesions. I'm not even interested in stage 2. Unfortunately, we don't have these mammograms and ultrasound everywhere. That's why the self-examination also becomes important. But then there are a lot of ultrasound machines, more ultrasound machines than mammograms. And so I guess the issue will be to train a lot of people, even in the rural areas. You know, if you have a handheld machine, you're a medical person, you can be screening the people and then catching at least something which is like 1 centimeter, which is stage 1, up to 2 centimeters is stage 1. And then we'll be getting somewhere. If and only if the people affected will go and seek treatment, because you can diagnose, and then because of the fear, stigma, and all the various reasons, the beliefs, cultural beliefs, all the various reasons which prevent people from, seeking attention. And these beliefs are not just in Ghana. Even Ghanaians who travel abroad, they still carry their beliefs with them.
Yeah.
So once you don't go for the treatment, that early treatment, then you know that even though we detected it at stage 1 centimeter, by the time you go, it's like 6 centimeters. And now in stage 3 or 4. So I think we still have a lot of work to do. But I just want to tell people we need to detect it early, and that there are facilities available. And if you get it early, by God's grace, please try and go and follow up with your treatment. Thank you very much.
You're welcome. Thank you too so much for the information. So this question came to mind. Are there funds, or should I call them, what do they usually refer to? Basically for those who can't afford, is there a way of helping them pay, let's say if they have to do surgery? One of the hospitals in Ghana, I don't know if they would want me to mention their name, but yeah, they are doing free breast surgeries. So can you mention a few places, or a few places where people can access such funds in case they need them. So this is to both Dr. Edmond and Dr. Dede.
Okay, so
Okay,
I
so
don't
maybe I
really know. I don't really know of any funds available yet. I think the National Health Insurance is trying or was trying to include the breast care.
Okay.
I haven't followed up to find out if they have included. Florence, would you know about that or any other?
The breast cancer actually is one of the very few cancers for National Health Insurance.
Okay.
And so once you are registered with the National Health Insurance, you do get some aspects of the treatment, let me say, subsidized. So when it comes to surgery, for instance, when you're on the National Health Insurance, your bill is lower than if you are not. When it comes to chemo, some of the drugs are covered. When it comes to the immunotherapy, some are covered. But not everything is covered. So radiotherapy, for instance, is not covered. Hormonal therapy, some are covered, some are not. The investigations that have to be done, some are covered, some are not. So the National Health Insurance definitely does help, although it doesn't cover everything. In terms of available funds, so I think because of all the awareness about breast cancer, we have various people and groups and societies and all that, at least work, would show up from time to time and say, maybe I want to support either this particular person because the person has gone to solicit for funds or somebody has gone to look for funds. Sometimes nurses do that. People, I want to support 5 people, I want to support 2 people. So we get a bit of that, which actually goes a long way to help. We know these days in October, it's a lot of, breast cancer all over the place. So there are certain, again, groups and societies that may organize. So one I know, for instance, the Shimota Golf Club. For the past maybe 3 or 4 years, October, they organize a pink tournament in support of breast cancer. And whatever they get, their proceeds, they donate to us. There's a medical choir, Med Chorale. Last year, they had a Christmas concert. It was in support of breast cancer. So we get quite a bit of that, which is very helpful to us. Because, like I said, even when you're on the National Health Insurance, your full costs are not covered. And so that extra support is important. And unfortunately, breast cancer treatment is not cheap at all. The good thing about it is it's usually spread over a number of months. So easily you could do a whole year of having treatment, chemo over 6 months, surgery, recovery over another month, radiotherapy over another month. As for the hormonal therapy, it goes for like 5 years, maybe even more. So the costs are spread out, but it is it's quite costly. So the support becomes very important in terms of the finances. For free surgeries, I don't know of anybody who does that. Occasionally, you may get certain groups coming in and say, we are organizing maybe free surgeries. It will probably be for a short period, maybe a week, 2 weeks sort of thing, but I don't know of anybody who does that on a regular basis.
Yeah. So the one I talked about is by the Snell Hospital. I'll share the flyer later with everybody. And they're choosing 10 people. I think there's a criteria. So when you apply and they choose 10 and then perform the free surgery. So I'll share that later. Thank you very much. There's a question by CD. Thank you. After a mastectomy, do all breast cancer patients have to do chemo? Are there women who did not have to do chemo? Are there any statistics on the survival rate of those who don't? Chemo not recommended because of oncotype. That's in bracket. I'm not sure what that means, but Dr. Dede, do you get the questions?
Yes, I do. So not every breast cancer patient needs chemotherapy. So I think that's a simple answer to the first one. After a mastectomy or even breast conserving surgery, it's not every patient with breast cancer who needs to have chemotherapy. So the next part is, are there women who did not have to do chemo? Yes. And usually those are the women who present with very, very, very early cancer. So if you have cancer, which is, let's say, less than 5 millimeters, irrespective of the type of cancer it is, once it's less than 5 millimeters, there's no lymph node involvement. We didn't mention lymph nodes, but cancer from the breast usually will move to the lymph nodes next. So every time we are looking, examining, we are doing imaging, we are doing surgery. We don't only tackle the breast, we tackle the armpit as well to look at what is happening there, and gives us a complete picture. So if it's very tiny and it hasn't gone to the lymph nodes, then you may not need chemotherapy. It's a little bigger, let's say 1 cm, at times even up to 2 cm, but it's strongly hormone positive. And all the other, you remember I talked about so many other things that we look at. So the grade is good. Even the hormone positivity, there are degrees of it. There's something we call Ki-67. And there are a lot of things we look at. But when you put all those factors together, and they are all pointing towards a very good program.
Hello? Hello? Can I be heard?
Yes, we can hear you. I think she dropped.
Okay, I think she's, oh yeah. Okay, but I still see her mic on.
Go straight onto hormonal, where the oncotype comes in. So the oncotype is a test that looks at.
Dr. Dede.
Yes.
You went off a bit, so we missed part of what you said.
So I was saying that if generally you put everything together in someone who is hormone positive, and everything seems to be pointing very small, no lymph nodes, all the other things are pointing to the fact that this seems to be a very good cancer with a very good outcome, a very low chance of it coming back again. Such a person may not need the chemotherapy and could go straight onto the hormonal therapy. Okay. But what would make your decision stronger or make you more certain of that decision of avoiding chemotherapy is doing a test like the Oncotype test. So it's a test that looks at certain, should I say, genes or certain factors that will determine whether the cancer is likely to come back or not. So they calculate a risk score based on what they have looked at. And if the risk score is high, it means that although we may look at it on the surface of it and it seems like this cancer will not come back easily, if the risk score is high, then there's still a benefit from getting chemotherapy. But if with what you see, it looks like it will not come back quickly and your risk score is low, then you can be confident in the fact that that patient does not need chemotherapy and can actually go on hormonal therapy. So maybe this would be a good point, a good place for me to also mention. I came on as a doctor, but I'm actually a breast cancer survivor as well. So 7 years ago, 2016, I was also diagnosed with breast cancer. I had a tiny lump. It was taken out. It was hormone positive. There were no lymph nodes involved. All the factors around looked good. I had the Oncotype test done. It was good. So basically, my treatment was to have the lump out, to have radiotherapy, and I've been on hormonal therapy since then. So I didn't need to have chemotherapy because of the particular scenario that it played out in. And by God's grace, I'm doing well and still going strong.
Thank you so much for sharing that. I'm sure lots of people are encouraged right now. Okay, so I see that Janet has put in their contact information. So that's for Ghana. And then, okay, there's the phone number for Canada as well. So I'll take note of that and also share on the WhatsApp platform. Oh, there was something I wanted to ask. Oh, it's just escapes me. Okay. Are there any other questions? Hopefully it will come. Other questions, contributions? We still have a bit of time. Janet, is there anything you'd want to add?
Yes. So I think it's important for people to tell their stories.
Yeah.
Because when you tell your story, it empowers someone else
Mm-hmm.
to know that they're not alone in their struggle, and it gives them the motivation to go on. Because I think sometimes people just give up because they think they're alone in their struggle. But when you hear someone's story and you see how they went through the challenge and how they're thriving, that also gives you, the energy and the motivation to go on. Some of the ladies that we call them precious ladies. At the beginning, when I met some of them, they did not want to even, disclose their identity. They're very shy. Now we have them as ambassadors. We have a fundraising event every year, big fundraising event in Ghana every year. And last year they actually had a play. They actually they had a play at the event. And I was just blown away because these were ladies who did not want people, they didn't even want their families to know that they had cancer. Some of them, their families didn't know that they had cancer. Right? They just being with other women and hearing their stories and empowered them. And now they are ambassadors. They go out and preach early detection, and come to Safe Haven, come join the party. So it is very important for us to speak out, because your story might just save someone's life.
Yeah. Okay, so I remembered my question. So this is a Christian-based program, and we always want to discuss that faith aspect as well. And I think you touched a bit on that in your presentation earlier. I want both you and Dr. Dede to address that. What's the balance between, because I know someone who, yes, she went to get screened and then she saw that it was seen that there was a lump, and then later on, supernaturally, she was healed. So where do you strike the balance as children of God? Basically, I don't know how else to couch the question, but how far do you stretch the faith?
Okay, maybe I can start. And unfortunately, from where I stand, it almost looks like our faith rather causes trouble for us. Because we see so many people who, instead of having treatment, like Janet said, the faith and the science should go hand in hand. But unfortunately for a lot of our people, it's the faith alone, and that is all. For me, like you say, how far do we stretch it? So you've seen that there's a lump, you've been told it's cancer. You are praying for healing. You see the lump is getting big. You see it's now become a sore. You see you can't breathe. And all that while you're still there waiting. Maybe that is not the way God has chosen to heal you. I don't think in hospital a lot of us doctors are Christians as well. And we pray as we go to work, we ask God to direct us. What we are doing, we believe, is also our Christian duty. So by all means, pray, and that is really important. Having a diagnosis of breast cancer and going through the treatment is not easy. I tell my patients, I won't lie to you, it's not easy. They are difficult times, but it doesn't mean in life everything is difficult. So again, I say that if you step on a road to go out somewhere, you could get hit by a car and you could die. It doesn't mean we all sit in our houses and we don't go anywhere. So yes, there are side effects of treatments that we give. There could be weakness, there could be that. It's all there. But it doesn't even mean it will happen. For most people, it doesn't happen. So sitting there and letting the fear of what could go wrong keep us from having treatment. It's really unfortunate. And then we use the faith to kind of cover it all up. And so we are praying and we are believing that God should do this for us. We know at times when we pray, God says no, or God says maybe. So maybe the supernatural healing we are asking for is not what he wants for us. He wants us to go through the experience and be an encouragement to somebody else. So it's difficult. I mean, I won't, and like Janet said, when you haven't been through the experience, you talk at a different level. For me, I've been through part of it, I would say. I didn't have chemo, but I've done a lot of the other things. So I have a fair idea of what it means to go through it. And it is not an easy thing. But we need to, like she said, hand in hand, science and faith hand in hand. And even as you go to the hospital, you pray that you meet the right doctor. Pray that the right things are done. You are going to theater. Pray that everything is done the way it should. Nothing will go wrong. Nothing will be missed. I believe God works in all those ways to heal us. So definitely, maybe you would say I'm biased because I'm a doctor, so I need to work. But clearly, Orthodox medicine works. Faith, prayer, God also heals. I won't say he doesn't heal, but when he heals, there's evidence that he has healed.
Yes.
So if you are not seeing that evidence and you rather see that things are getting worse, I think you need to find the other ways in which God may be pointing you. And let's not wait for it to get to a point where the doctor can't cure it anymore. So at a very early stage, seeking treatment, add the prayers to it. And I believe really that's the way to go. If God wants to heal you supernaturally before surgery is done, he will do it.
Yeah.
It's possible for him to do it. If you come and we can't find the cancer anymore, we're not going to insist on doing surgery. We would do the necessary test to prove that it's not there. And if it's not there, we are all happy.
Yeah.
I mean, as if we are so excited to have to go and take off somebody's breast. We know how it feels like, but we know that if we know that that is what will make you better, that is why we go ahead and do that. So, I mean, that is where I would come from. By all means, let's pray, but let's also do the Orthodox medicine. Unless God intervenes and takes the disease away miraculously, which we can see, then we can say that he has healed you, and so you don't need to go along that direction.
Yeah. Thank you so much. Janet, anything to add on?
I think Dr. Dede has said all that I wanted to say. But yeah, like she said, if you're just going to say that your faith can only believe for, supernatural miracles, then you're limiting God. Because in the Bible, Jesus used different means of healing people. If we say we are Christians, he didn't just do one thing, right? And sometimes, you'd see the results of his miracles not instantaneously, right? So, and we've all been given a measure of faith. So, for those who their faith is not up to the level where, God can just turn the water into wine and, that kind of thing, they also have to have something to hold on to. And like Dr. Dede said, for me, my faith was that, first of all, I will be diagnosed. So when I was praying, my faith was always, if there's anything hiding in my body, let it not hide, let it come out so that I can be treated. And then I prayed, let me get the best doctors. Let my healthcare professionals care about me. Give me intelligent doctors so that they don't make mistakes, because a lot of people die from mistakes. There's stories here where people's breasts are chopped off because, there were wrong markets. So they've put certain things in place now, not scaring anybody. but mistakes are made. Yeah. So that's where my faith was, right? And also my faith was that I will not die prematurely. So however God will bring that about is up to God. Yeah. Right? My faith was that I will not die prematurely and that I will be healed. Standing on the word that by his stripes I'm healed. Yeah. Right? So the end goal is that I'm healed. However God chooses to do it, he will do it.
Yeah. Thank you. That's a good one. Thank you so much. So our time is up. I would like to round off here. I'll take your final remarks to us. We'll start with you, Janet.
Okay. So, sometimes people think we talk too much about cancer, and we are prophets of doom and all that, No. If I had my own way, nobody would have any serious disease in this world. But unfortunately, we live in a world where these things exist. So when you're faced with a challenge like that, what do you do? What do you do? You don't want to, just be unprepared for things that happen to you. So when you people are offering education and are offering these things, we should not run away. It's information, and information, knowledge saves lives. So let's take advantage of what is out there, and inform ourselves and equip ourselves to make sure that we live long lives.
Yeah. Thank you very much. Dr. Dede, but before you speak, there's a question for you. So maybe you can tackle that and then give your final remarks. It says, please, what is the right weight mentioned?
Okay, so I talked about maintaining a healthy weight. So generally we tend to use the body mass index. So there's a formula that we use, height and weight, and we calculate body mass index. I mean, when you Google it, you'd easily be able to do that. You put in your height, your weight into the formula, and usually would say between 25 up to anything less than 30. Between 25 up to less than 30 is okay, or it's normal weight when you put it that way. More than 30, it's overweight. If we go more than 40, then we are getting into, it's actually 20 to 25, which is normal. 20 to 25. So 25 to 29, why am I getting confused? 29, I think it's overweight. And then more than 30 is obese. We can cross-check it. Okay. But usually we use a BMI. And once we are within the what we call normal BMI, we would say that is or that's the right weight in quotes that I referred to. Yes.
Okay, so what I'm seeing is
all right. So
18.5 to 24.9. That's within the healthy
exactly.
weight.
So usually we do about 20 to 25.
Yeah. And then 25 to 29 is overweight.
It's overweight.
And then 30 or higher is obese.
It's obese. Exactly. Yeah. Thank you.
You're welcome.
In terms of what to end closing remarks, I would say the early detection is not something, it's something we cannot overemphasize, because that is really where there's the biggest likelihood of a cure. And not just that, but then even when it comes to the treatments you need to have, the earlier you pick it, the less likely that you may have to go through all the treatments and do a lot of very drastic things done. So generally, picking it up early, it's advantageous, I mean, in all respects. And just something that Janet said, I want to also touch on again about seeking a second opinion. So people would go to the hospital, are told they have cancer, told about the treatment options, and because they don't like what we have said, they just go home and that is it. Seek a second opinion. I find that at times people come to me, and although the first time they spoke to a doctor, let's say they were told about a mastectomy, they vehemently refused it. When they come to me and I say the same thing, the stance is softer because they have heard it before. They've tried to process it before. So at times the second opinion just even helps you to know that this is really the way you have to go. Because I've seen 2 doctors, I've seen 3 doctors, they are all saying the same thing. So it helps you to appreciate that really that's the best treatment and I should go for it. What not to do is just to fold your hands and sit at home and not do anything. That's definitely, unfortunately, cancer doesn't sit and wait for us. So even if you are not very comfortable with what is being said, one, either seek a second opinion or speak up and discuss with your doctor, because there are different options for treatment. I may mention just one option because I think that is the best. But if you are not comfortable with it and you want to refuse that, then we could go on to the plan B. But when you don't say anything and you just disappear, then that whole chance to be treated is lost. I mean, it's so unfortunate. We see people who came, we could have just given them hormonal treatments and it would have kept the cancer at least under control to some extent. But because they didn't want the surgery we mentioned first, they disappear. And the next time they come, we can't even do the hormonal treatment. We have to now go on to chemo next. So dialoguing with your doctor, seeking another opinion, these are all things that are very important. Reading on the net, you come across so many things. At times it backfires. It scares you rather than giving you the information you need to move forward. So again, I would say, by all means, read, because it's important to be knowledgeable. But don't get so afraid that it just makes you clam up. When you see things that make you a bit scared, just go on and speak to your doctors. They will discuss it with you. They would explain things further. You have all the options you can explore, and you can have the treatments, the best treatments that you would also be comfortable with. I think I'll end it here.
Thank you very much. This has been a really informative session. So we've heard it all. Let's not wait. Let's not be afraid, especially because we are children of God. Let's trust God that He's in control and He's given us the wisdom to take care of our bodies. So let's be bold and go out there, get screened, get treated, so that we can live the abundant life that Christ has given us. Thank you all so much for coming. Thank you, Lawyer Janet Brakohiapa. You haven't corrected me. I hope I'm pronouncing your last name well. Brakohiapa. Okay. Yeah. Brakohiapa and Dr. Florence Dewey. Thank you very much. I really appreciate this. And to my audience, God bless you so much for coming. Once again, if you haven't subscribed, please go to the YouTube, subscribe, and share the link. And these things we discuss are very important for all of us, not just we Christians, but others out there as well. They all need to hear and be helped. So, Janet, please pray with us to end.
Heavenly Father, we just want to thank you. Thank you for this opportunity to learn more about this disease, which plagues a lot of people and which terrifies so many people. Thank you that by our discussing all these things, Father, we take the fear out. And we thank you, oh God, that you've promised us good health. Help us to find many ways, oh God, in wisdom to be able to go through these challenges if we do go through them. We know you will always be with us. We thank you. We bless you in Jesus' name. Amen.
Amen. All right. So I'll see you all, God willing, next week. Have a blessed week. Thank you too. You can unmute yourselves, share your face.